can breast implants cause enlarged lymph nodes?
So breast implants cause inflammation that occurs as a result of the body recognizing the implant as foreign. Now, sometimes the reaction is very focal and mild, and there is no true reactivity initially or maybe later on that will present. Now, what happens over time is the implants start breaking down, and this is consistent with the implants not being lifetime devices. There is that phenomenon of gel bleed. What happens is the inflammation thus occurs, and we know this from the many pathology reports, and we know this from the histology of the capsule, where you have synovial metaplasia. That's the reaction of the body around the implant. And so you will see once the inflammation occurs, sometimes you have more inflammation, what they call acute and chronic inflammation. And once the inflammation occurs, the body's giant cells, histiocytic cells, they start reacting, the macrophages, and the body's immune system goes on alert. And now the lymph nodes, this is where the immune system cells are harbored, this is where they are in place, they start becoming reactive. So we know many patients who have palpable lymph nodes. There are patients, in some select patients, where imaging was done and MRI showed what appears to be silicone within the lymph nodes, and the patient has intact implants. There are patients who have ruptured implants, a lot more concentration of lymph nodes. This past weekend, I talked to a patient who had lymph nodes that were the size of a plum, according to her, and they were seen on an MRI, and she's being followed by the hematologist to make sure that they are not lymphoma. And the point here is, in these patients, the biopsy certainly can be done of that lymph node to see what is not breast cancer, what is not lymphoma. That would be the standard of care. And the goal here is to rule out any malignancy. And the lymph nodes then can be evaluated by X-ray dispersive analysis or electron microscopy to clearly identify what is silica. And remember, we know from the many patients who have had the biopsies done that there is silica in the periphery within the capsule, around in the soft tissues around the capsule, especially if it's a ruptured implant. And the body is trying to contain and react and protect itself by this foreign body giant cell reaction that we know of. Now, eventually, all implants will rupture, some in a matter of years, 10 years, 15 years being the average lifespan, as you will see the medical literature that talks about it. But there will come a time inevitably where the implants will become reactive, and they're certainly not lifetime devices. On average, 10 years is what is recommended before they need to be replaced. And the point here is the body's immune system is trying to protect itself from this foreign body, and there are certainly signs, reactions, reactivities now in the way of palpable lymph nodes and the reactivity of breast implant illness, with the many symptoms of breast implant illness, and sometimes physical marks, i.e. like rashes that occur in and around the chest. And so these are what are red flags or signs of where the body is reacting, and that one must seek consultation with a plastic surgeon so as to get attention and definitive management and ultimate removal of not only the implant but also the capsule and the inflamed tissue around the capsule, such that the entire inflammatory burden is removed, as you will see from the many pathology reports that we have discussed on social media. This is Dr. Khan, Executive Plastic Surgery.